We are recording. Welcome to Trenton Talks on WIMG 1300 AM and WPHY Verizon Channel 28. Yours truly, your host, Gerald Trueheart with the Trenton Board of Education Community Engagement. We're here tonight with our special guest to talk about COVID-19. Where do we go from here? We have on the call tonight Dr. Adela Amos Lopez, Director of the City of Trenton Health and Human Services. We have on the call tonight Dr. Rachel Evans, Chief Medical Officer for Henry J. Austin Health Center. We also have on the call tonight Grady Griffin. He is the Acting OEM Coordinator, Office of Emergency Management, Director for the City of Trenton as well. We also have on the call tonight our favorite Supervisor of Nursing, Micah Freeman, as well as our favorite Parent Coordinator and Homeless Coordinator, Liaison Denise Crease, and our Acting Superintendent, Trenton Public Schools, Alfonso Llano. And so we have a host of questions for you tonight to start the discussion. We're over to you, Micah.
Thank you for having us. Thank you for allowing us to continue the conversation of COVID-19 from the school district's perspective and working with the community. So my first question is for the City of Trenton, and either person can answer, is when are the COVID testing dates, and why is that a benefit to our community?
Okay, Director Grady, you want me to answer that? Okay, sure. So our testing, we just had a testing date today, a testing site done today. So when we do have our testing, we push for 2 days out of the week. So we're scheduled today and Friday for Martin Luther King School for testing. And then the following week, we're at Mott Elementary School on Tuesday and Friday as well, 11 to 3. The age is from 5 and older. And the reason why we pick select schools is based on a statistical data that we receive based on hotspots. And that's coming from the Trenton Health team. They do our statistical data and they let us know where a lot of the hospitalizations, the ER visits based on COVID-related symptoms. And so those are the hotspots we look at. And we see that East Trenton was a hotspot. And so we last week had our testing site at PJ Hill. And then we see that North Trenton was the second hotspot. And of course, the new UK variant is also in the North Trenton area. So now we have our testing this week. And we always have it at my elementary school because of the Hispanic community. That area has always had a higher number of positivity rates in hospital visits. That has lessened over time, but we continuously have our testing at the my elementary school in South Trenton. And there's a benefit to the community. Testing is vital. We know that with this COVID, it's going to be around for some time. And I always say, know your status. And so when it comes to vaccination, we know our children cannot be vaccinated. So as adults, we should be planful and be tested. And that is a benefit to the community. And just looking at it holistically and looking at everyone being healthy and well. And so we know that with COVID, you can be asymptomatic and symptomatic. You can show symptoms or not. And so the testing will show proof whether you are positive or negative. So it is a benefit to the community to know your status.
And I just want to add to what Dr. Lopez said. Our new I guess I want to say campaign and bumper sticker will be COVID-19, know your status. You know, because we are definitely pushing for people to know their status, and that is so important. And that is what drives this endeavor to keep going. So we advocate for people to know their status. Know your status. Know what your status is before you put yourself or anyone else in a vulnerable situation.
Great, thank you.
Yeah, I think that's a good segue into actually this next question for Henry J. Austin Health Center is how does the virus spread? I think it's important for folks to understand how the virus spreads. And this question is for you, Dr. Rachel Evans.
Thank you. That is such an important question. I think at the beginning of the pandemic, we heard a lot about surfaces and we got a little carried away with disinfecting. It turns out that's really not how the virus spreads. This virus is spread not just through respiratory droplets, but also through airborne transmission. And that's really important because this is why wearing a really excellent mask and avoiding indoor spaces with other people who are not safe or part of your bubble is so important. I think we've heard a lot about distancing, but the thing you have to remember is that if you are 6 feet apart from somebody indoors, those respiratory droplets and that airborne virus doesn't know where the 6 feet end. And so we've seen a lot of transmission from people thinking they're being safe because they're indoors, they're trying to be distant, and they're scrubbing down their surfaces. But the most important thing to remember is that this virus comes out of our noses and our mouths, and it comes out and it hangs in the air and it stays there for a little while. And so you just always have to picture that airspace, who's in your airspace, who's breathing the air that you're breathing. If they have COVID, you have COVID, and vice versa. The only way to change that is by wearing a really excellent mask. Wearing a really excellent mask, or possibly 2 masks, is so effective just because it keeps all of that virus inside. It's not dangerous to me. I already have the virus. The way I heal from the virus is not by expelling it through the air, but by fighting it with my immune system. So there's no danger to me wearing a mask, but it does keep me from passing it on to somebody else. And then if I'm wearing a mask that's filtering everything I'm breathing, that keeps me from catching it from somebody else. We know that the newer variants have now been seen in our Trenton community as well, and those are even more infectious. So you're even more likely to catch them from being nearby somebody else. You really want to be avoiding those indoor spaces with people who aren't wearing masks, and particularly if you haven't been vaccinated. And when we talk about a good mask, the important thing is it has to fit your face and really touch every point so that air isn't coming out. So if you're wearing a cloth mask or a surgical mask, and you can feel the air pushing up towards your eyes or pushing down towards your neck, you don't have a good seal. You can just sort of try puffing in and out a little bit. And if you feel the air coming out, then you know that you can be getting your virus into the air, or if there is virus in the air, it can get in there. So a lot of people still sometimes wear a mask sort of as, well, I'm wearing a mask, but it's kind of hovering right below the tip of my nose. You think about all that virus that can just come out or go in that way. That's really what you want to think about when you're wearing a mask. Of course, hand washing is always important, but truthfully, the vast majority of transmission occurs from breathing the air and the droplets that somebody else just breathed.
Thank you.
So Dr. Lopez, this next question is for you. So where can our parents and our community members get more COVID information?
Yes, I'm glad you asked that, Superintendent. And Dr. Evans, I'm thankful that you really explained about the mask. I know I'm deviating a little bit, but I was jumping internally when she was explaining about the mask, because that's vital. Again, you have people in the community, their children not wearing masks. And when they are wearing a mask, they're not wearing it correctly. So I'm glad that you did expand on that and tell them how to know if air is coming in and all that. That was wonderful. So I'm jumping inside with you saying that. It's good stuff. As far as COVID information, Superintendent, so they can, our website, you can go to the City Hall website, which is Trenton, www.trentonNJ.org. That's the City Hall city website. Also, we have our email. If they want additional information, they want to be registered on the state registry or even on the city website in regards to additional information about vaccine or testing, they can send it to COVIDVAC, VAC, at TrentonNJ.org. So it's COVIDVAC, VAC, at TrentonNJ.org. Also, they can call us at 609-989-3242 and press 0 for the operator. That is covered Monday through Friday, 8:30 to 4:30, because I know sometimes individuals call after hours or on the weekend and they don't receive a live body. It's not a call center, so I just want them to be aware of the time frame. But if they leave a message, if they're able to, because sometimes the voicemail is full, then we will return the phone call for that. And then within a week or two, we are going to have our own Facebook page, the Department of Health and Human Services, and a slew of information regarding COVID. We're working on that now. We'll be up and running. And so once we get that, we're hoping that you share it so your parents and children can really follow the page and get as much information they can regarding COVID for the city of Trenton.
Quick question. So New Jersey, they put out a vaccine call center. Now, when families reach out to that line, does that somehow get interceded into your department? Do you know?
The 211 number?
It's 855-568-0545. It's the New Jersey Vaccine Call Center.
Okay, yes, and that's for the state. And if they're calling from the city, Denise, then what they'll do, if it's something that's relatable and they need to, they will refer that information to us, whether we receive it by email or they will call us. So there is a transference as well. And I do believe they put it on the website because someone sent us an email and said that our email and our telephone number was on there as a place of reference. So which is a good thing. So that means we are putting it out there for our parents, our community, our children to really see that information regarding COVID.
So Dr. Evans, I want to talk about just real quick. I see now that Dr. Fauci wearing 2 masks, myself wearing 2 masks, and why should we start wearing 2 masks as opposed to 1? That's the first question. And then the second question is, why is our partnership?
Oh, you just went muted, Micah.
Why? So the first question is, why should we wear 2 masks?
So we now have a lot more information about masks than we did early on in the pandemic. And there have been a lot of really good studies looking at how is the virus spread and then how can we prevent that spread. What we know is that an N95 mask, which you've probably heard about, prevents us from spreading that virus 95% of the time. So that's really good. That's actually as good as a vaccine. If everybody wore an N95 at all times, we'd be very safe. Just a little caveat though, remember it only works while you're wearing it. So for example, if you think about the fantasy of safe indoor dining, I can guarantee you that no matter what any governor of any state says, there is no such thing as safe indoor dining when our rates are 10% positivity in terms of our testing in our community, because there's a really good chance that someone else in the room is carrying COVID, and you can wear your mask and follow all the guidelines. And then when you sit down at that table, you magically take your mask off as if it were somehow a different space, but you're still sharing that airspace. So that N95 is only effective while you're actually wearing it and while everybody else is wearing it. And think about that. I don't want to digress too much, but eating is the big area where we tend to think, oh, it's going to be safe to take it off and we'll be distant. But really, truly, eating in the company of other people without your mask on is probably the best way to catch COVID. There is no safe way to do that with someone else who has COVID, and there's no way of knowing for sure who does and doesn't have COVID right now. Okay, so that being said, an N95 is 95% effective. If you have a regular surgical mask, and then you cover it with a good quality cloth mask that fits close to your face, the reason it's doubly effective is the cloth mask has a certain kind of fibers, and the surgical mask, beautiful Micah, that's great, has another kind of fibers. And when you put them in front of each other, you get even better prevention of any air going in and out. And the cloth mask also helps to kind of put that surgical mask close to your face. So Micah doesn't have a huge face. She probably notices that when she wears a surgical mask without that, there's a little bit of gapping up here. She has to keep pinching her nose. Down around here and around the chin, we can see there's a little bit of airspace. But then once she puts that cloth mask on top, it just kind of helps hold it in place better. And if she does that fit test, it's going to work a little better. So if you wear 2 masks, a good quality surgical mask and a good quality cloth mask, that has been shown to be 90% effective. So almost as good as an N95. And it's much less expensive and much more sustainable for everybody to actually do that combination.
And you could be sporty at the same time.
That's right. And then you can put whatever you want on your cloth mask. Exactly.
Right.
And then you had a second question, something about
just really quick, why is the partnership between Henry J and the school district valuable?
I can't imagine having this any kind of pandemic response without the partnerships we've been lucky enough to have with the school district, with the city, with the Department of Health, with everybody who's on this call and all our other community partners. I think our families are so confused and often so vulnerable. There's all sorts of sources of information that are maybe not as reliable. And when we have a family that truly needs medical attention or has questions, being able to communicate between the school district, the parents, health center, it's just been invaluable. We know that when we have families that are in trouble and we're trying to reach out, it's helpful to work with all the wonderful staff you have at the schools. And then vice versa, as we've been trying to figure out how do we have testing, how do we have vaccination, how do we do school safely and what does that look like? I think our partnership has been so important. The level of insight we have with the city, with the Department of Health, with the Trenton Health team, into what our rates look like, what our numbers look like, that just allows us to make these excellent decisions. And so other communities that don't have that same level of communication or true insight into what's happening in the city aren't able to make the best choices for their schools or for any of their other public institutions.
Dr. Evans, I have a quick question for you. So all these walk-up centers that are doing the testing, is it free? Do they have to show ID? I'd just like to get that information out there for families.
Yeah, great question. So the test itself is always free. Where it gets a little tricky is in terms of who's administering the test. Sometimes they do a telemedicine visit. All of the walk-up centers that are through the state, those are always free. And when it's through the county or through the city Department of Health, it's always free. Where it gets a little tricky is if you need photo ID or not. And so there have been some circumstances that require photo ID and others that don't. And actually, I know that in the past, when the county did do testing, there was some concern about needing photo ID. At Henry Johnston, when we do testing, we don't require photo ID, but we do require that you have a visit, and then we work to make that visit affordable if need be. And then I don't know about the pop-up testing that's happening at the schools with the Department of Health. Are they asking for ID? I think they were, right?
Yes, that is correct. We are asking for, you have to bring identification, but we also ask you to bring your insurance card if you do have it. Although the test is free, we will bill the insurance. If the insurance pays for it, then it's free to you. If the insurance does not pay for it, then it is still free. So, yes.
And I would say that one tricky area is our community residents who maybe don't have photo ID. That has been a bit of a challenge. That's something we can assist with at Henry Johnston for sure. So if you know someone in that category, please have them reach out. There have been times at different points in different waves where as a health center, we've just gotten a flood of people calling and asking us for testing. And what we've started trying to do is really walk them through these steps to see, can they get testing elsewhere? Because there's only so many tests we have. And if they have photo ID, if they have transportation, we'll recommend one place. If they really truly need to walk up to Henry Johnston and get that testing there without photo ID, then we can make that happen. So there's always a resource. It's just a question of looking for those resources. And I think if you're wondering about testing, the Trenton Health team has a great resource about testing options on their website. I know the City Department of Health has really excellent resources, and the city website does as well. So taking a look around just to see what those options are, there's always something that'll meet the need.
Yes, thank you, Dr. Evans. I think it's important that we also note one of the things that Dr. Griffin just said. He said that the COVID-19 Know Your Status is the new Trenton campaign. I think it's important that we put that out there. I put it in the chat, so those who are listening, our attendees, Jamie Crespo and Angela out there in our community hearing this, COVID-19 Know Your Status, share that Trenton campaign. The other thing I wanted to ask and kind of bring back is the phone numbers for Trenton. If we could, Dr. Lopez, if you could share that phone number again with us.
Sure, it's 609-989-3242, and they press 0 for the operator.
And you said there were some time frames that they should work within. They can leave a message, but what are your time frames for your lines to be open?
Right, it's the typical workday, Monday through Friday, 8:30 to 4:30. And we know that we're receiving volumes of calls after hours and even on the weekends, because times that we are in the office working on some logistical work, documentation on a Saturday, the phone lines are constantly ringing. So we know they're calling after hours and on a weekend. So we just want them to know that you would definitely get a live body Monday through Friday, 8:30 to 4:30.
We're asking for patience because you are on
Yes.
the job and getting it done.
Yes.
Just be patient, leave a message. Dr. Lopez and her staff will get back to you. Please just be patient as you call in, as the lines are somewhat busy at times, and folks are calling in during the day and after hours. So Denise, you also mentioned, Denise, about a phone number for the state. Could you share that with us as well again?
Yes, let me pull it right back up.
Okay. Okay.
Just give me 1 second.
No problem. All right, you come back to that question. So I'll ask the question of Dr. Lopez. One of the things we want to find out is if you could just share with us the plan for getting residents vaccinated.
Oh, wow. So the COVID-19 know your status, that vaccination is key. I must say the community was hesitant in the beginning. We understand about public mistrust when it comes to healthcare, and there was a lot of hesitancy regarding being vaccinated. But we have been out educating and just explaining the difference and about the vaccines and about testing and about, just some of the CDC guidelines and protocols. And so we realized that a lot of them were interested. They was in the gray area. And as those who were still on the cusp of wanting to be vaccinated, we just told them, go ahead and register, because by the time it gets to your name, you probably change your mind. And that has happened. We have hit populations in the community, like the Hispanic community, who have been hesitant, and they still are a little bit, but we have making some segue in which we have spoke with faith-based leaders, civic organization leaders, and really explaining and really the importance of vaccination. And so now we're seeing that has actually increased as well. And so that's a great stride in the Hispanic community with that, because that has been a struggle for some time. We still need some way to go, but we are making some segue in that component. So our mission at this point, we have vaccinated about 1,200, correct, Grady? 1,200 residents with their first dosage with three vaccination clinics. And so that's great because we started the second week of January. And so moving forward, there have been some changes. And so we know how to track and adjust when it comes to that. So now we will be vaccinating at the Kerr Arena with the assistance of the county. And so we're looking at vaccinating approximately 235 residents a week. We're hopeful that the numbers will change, but right now that's what we're allocated. And so that's our plan, to continuously pull off the state registry, but we also have a waiting list of individuals, because our goal, on top of knowing your status, is not to waste the vaccine. And we have not wasted those 1,200 vaccines that we received. We have used every last one of them, and that's the goal. And so if someone is unable to make their appointment from the registry, then we will pull from our waiting list and we'll have someone come in and be vaccinated. So it all works hand in hand. And that's our goal. That's our mission, to really get as many of our residents vaccinated. And I will not use the term that the superintendent will not requested us not to say, but our goal is definitely to have that the community vaccinated. That's the goal. And if those are still, we know that individuals may not be cleared by their doctors, right, to be vaccinated. So then again, that campaign about know your status, the testing is very important, and then still adhering to the CDC guidelines of wearing the mask, as Dr. Evans explained thoroughly, and watching your distance and washing your hands. And so we're going to continuously message that as we go forward. But that is our plan for the city.
I have a quick question for
Yes.
those listeners that are just learning a little bit more about the vaccines.
Yes.
So vaccines that you're administering, it's 2 doses, correct?
Correct.
Okay, I just
Yeah.
wanted to make sure.
And the city we're administering Moderna. That's the vaccine that we're administering, because we know it's also Pfizer. So it is 2 dosage, and it's 28 days between the two.
So there's a question in the chat just asking for clarification. So the city is or is not using or providing the vaccine at this moment. And I think I heard you say clearly you have a campaign, you are moving forward with the vaccine, trying to spread to as many of the eligible residents as possible. So
Oh yeah, the city is vaccinating. It's just that we're moving from our previous location at the Trenton Fire Headquarters, and we're now going to be at the Kerr Arena. But we're vaccinating every week, and our number that we're allocated for the vaccines is 235 as of this point. And we're going to use all 235, Superintendent, and advocate for more as well.
Absolutely. So that's in response to one of our participants' questions. So
Yes.
I believe Angela. So if Angela wanted to sign up for the event, the vaccination that could be supplied at the Kerr Arena, they have to use which resource to register?
She has to be on a state registry, register there, but also she can send an email to the covidvac@trentonNJ.org to say that she wants to be put on our waiting list. Because again, the state registry is so many individuals that's on that list as well, but we also have a waiting list for the city of Trenton.
COVIDVAC.
VAC at TrentonNJ.org.
Thank you.
You're welcome.
And one thing I'll add to that conversation, it is such a great question. When do we just have all the vaccine we need available in Trenton for Trentonians? And just to remind everybody, even right now, with all those great numbers you've heard, the state supply is really very limited compared to all the people we know who qualify and all the vulnerable people in our community. One of the things that makes me really happy is, as we've already heard, I think in the beginning, I heard a lot of questions about the vaccine and a lot of hesitancy. I know there have been several really wonderful forums with our faith-based leaders. There's Zooms and webinars that you can access through the Trenton Health Team website. There are some at the Henry J. Austin website in both English and Spanish talking about the vaccine and really talking through many people's questions and concerns. And what we've started to hear at Henry J. Austin is more people who now are ready for the vaccine. They've seen that we've vaccinated millions and millions of people with these vaccines. They truly are very safe. And we're all just getting very tired of seeing our friends and family sicken and sometimes die from COVID. So I've seen that change. And what we're hoping for is that sooner rather than later, the state of New Jersey will have enough vaccine that we truly can say, okay, now we've got ways to reach out to everybody in our community who wants that vaccine. And it is, I know, having interacted with the state website myself, it can be frustrating. Definitely try to register there for sure. Keep an ear out through the city, through Henry Justin's website, through the Trenton Health Team. When there's more vaccine available, we will let you know for sure. And the other thing to think about, which is hopeful, is it sounds like we might have the Johnson & Johnson vaccine available in our state within a month, by the end of the month, hopefully. And that's great because it's also very effective and it's just one dose. So there isn't all this fussing around trying to remember your second dose, worrying about that. And we think that's really going to be able to make that vaccine most available where it really needs to be available right now.
So there's a question in the chat. What age can the vaccine be administered?
It depends. The Moderna vaccine is 18 and up. The Pfizer vaccine is 16 and up. And there are now trials going on looking at both those vaccines in younger children. For our local community, most of the larger distribution has been of Moderna, so only 18 and up. The Pfizer vaccine is the one that requires very special refrigeration. And so it hasn't been as publicly available yet in our community, but that may happen as well.
And then a follow-up question. If someone is positive or they had a history of being positive, now they want to, because they want to get the vaccine, is that appropriate?
Absolutely. We are still learning about the immunity from this virus. We know that having the virus makes you a certain degree immune, but people still can catch COVID, and in particular the new variants. So we definitely recommend that you go ahead and get the vaccine because that increases your protection. Initially, we were thinking maybe you need to wait 90 days or check for antibodies, but now there's really clear guidance from the CDC that you just need to wait out your quarantine time. You just have to do what your usual 14 days from when you first get sick, and then you're eligible for the vaccine at that point. And that's really important because I think a lot of people think, okay, now I'm protected, but particularly when we talk about newer variants, we don't know what our body is going to do if we've had one COVID and now we see another variant. So we really recommend getting the vaccine if you're still in that high risk category.
One of the questions I have, I think is an important question, is I just had my shingles shot, and I'm actually going to get my second shingles shot later on next month in March, because that's also a 2-dose. When should I be prepared to take the vaccine, being under the conditions that I'm having one vaccine with the shingle shot twice now? Should I wait? Do I have to wait to get the vaccine for COVID?
14 days in either direction for any vaccine. So if you can squeeze your COVID vaccine in 14 days before your second shingles dose, then you'll be all set.
Good question.
Yeah.
Thank you so much. I think it's important to note some things that Dr. Lopez just mentioned about the Cure Arena in the county, 235 a week. That's starting shortly. And you have to be registered to get that dose. Is that correct, Dr. Lopez?
Correct. We're pulling off of the state registry, right? Their system.
So that's important. And also, again, just want to iterate, Moderna for age 18 and up, Pfizer is 16 and up, and again, 14 days. Between 14 days is the magic number, it seems, from the science, from the doctors. Dr. Lopez and Dr. Evans on the call tonight. Yano?
Yes, so I think we've covered, so I have another question that I would like to ask. And we anticipate that tomorrow there'll be some sort of update from the CDC based on school guidelines. What do you anticipate learning from the guidance that's, what are your thoughts? What are you hearing? Oh, and that'll be to anyone who has information or could respond. So Dr. Evans or Dr. Lopez or Director Grady, Griffin, whoever would like to go first.
I think there's a lot of conversation about trying to extend the vaccine to all educators, to everybody who's going to be present in the school setting, so that we can, a very, very high priority, of course, is allowing our students to return to in-person schooling. And there's some thought that maybe vaccinating all our educators and all our school staff will help with that. I think the main challenge there is just always to remember that we know that the vaccine helps protect us, but we don't know anything about how well it prevents transmission. We know that people who get vaccinated still become infected with the virus. They just fight it very effectively. And so while you're waging that effective war against the virus, you may still be contagious. You might still be at risk of passing it on, and possibly even more so in the sense that you might not have symptoms. So you could, when you've been vaccinated, become exposed, then be contagious, and then be just wandering out in the community or the classroom. So the challenge, of course, is that protects the educators, but it doesn't necessarily protect the children. And we know we're still a ways off from pediatric vaccines. Either way, it's a wonderful idea. I hope it does happen. I hope it does get expanded. But the other thing to remember, and this is something that we struggled with when at least in New Jersey, the governor decided, okay, now we're expanding to 65 and older, and that happened across the country, but we just didn't have those vaccines. And so of course people think, yay, I qualify, but we still have the same 200 vaccines we had last week. So it's just, those expectations. I think it's good to open it up. The more people we vaccinate, the better, but we do just need a lot more vaccine availability.
I just want to reiterate, there's a question in the chat about the doses. Moderna is 2-dose requirement and Pfizer is 1 dose. Is that correct?
The Pfizer and Moderna are both 2 doses.
Both 2.
It's the Johnson & Johnson that is 1 dose. I think, and some great questions about, do the 2 doses help for more immunity? We do know that you've probably heard a lot of question about, should we be making sure everybody gets 2 doses or making sure everybody gets at least 1 dose. After that first dose, you might have 75 to 80% immunity, but you're not going to get that full 95% immunity until you've taken your second dose. Thinking about that immunity is so important to remember. 95% means that out of 100 people who get the vaccine, 5 of them are going to get a full-on infection. And that doesn't mean the vaccine doesn't work. That's just what those numbers mean. So if you get the vaccine, you're not Superman. You might be Superman, but you can still catch COVID. So you can't go running around out there saying, I don't need to wear a mask. I don't need to do any of this. The really good news is that even in that 5% who still developed symptoms and had an active infection, none of them wound up in the hospital. None of them wound up in the ICU. So we don't know about transmissibility, but we know that it does seem to prevent that severe disease. And this is the other incredibly good news about the Johnson & Johnson vaccine. The numbers of people who were protected, it's not quite as high. It's not that full 95%, but of the people who got sick, again, none of them got that severe illness. They did not wind up in the hospital. They did not wind up in the ICU. And that's really important because that's what we really need to prevent. A mild COVID infection is definitely no joke. I'm sure you all know, we all know people we love. We've seen a lot of patients who had a mild infection and are still having sequelae, still having symptoms 3 months, even 6 months later. It's something you still want to be careful with. But that piece of preventing hospitalizations and ICU visits is so important. And that happens with any of the vaccines. And in particular, the 1-dose Johnson & Johnson is going to be really important for that.
So the question in the chat is, if I get the vaccine, then get COVID, do I get more symptoms or I get less symptoms? What happens if I get the vaccine? Do I get more or less symptoms if I get COVID?
You get less symptoms.
Less.
Yep.
And then there was the follow-up question was, if I get the Moderna, can I get the Pfizer for the second dose or vice versa?
At this point, there's not a lot of guidance about mixing and matching, and they're recommending don't do it just because there's no studies. Interestingly, they're very similar vaccines. They work on the same protein spike, it's called. They help you recognize the same part of the virus. And what we know about other similar diseases, there are other infections where we have different brands of vaccine, and you really can mix and match them. And eventually the CDC has guidance about how to do that. My guess is that one day down the road, the CDC is going to put together a beautiful blueprint that says, here's what you do if your first dose was Pfizer. Here's what you do if you get AstraZeneca. Here's what you do with the Sputnik vaccine if you happen to be in Russia. And you do all, and here's when your next booster is due. We just don't have any of that information yet.
So the short answer is, if you got the Moderna, you get the Moderna again.
Yep. Yeah, and that actually brings up a really important point. There's been so much confusion about second doses. The state has been very consistent about one thing. Wherever you got your first dose is where you're supposed to get your second dose. The only exception that I have yet encountered is someone who was incarcerated for their first dose, because there was just no way for them to get hopefully they're not getting back in for their second dose. So that's the one exception. But
yeah.
For the most part, your first dose is going where your second dose was. Often the people there are confused and they don't even know. But so far, every time the state has followed through and people have been able to return to that first site to get their second dose. And you should do that because the way the vaccine is shipped, that dose is going for you to that place. And if you don't go to that place, they might have to waste that dose. And if you go somewhere else, they won't have that second dose for you.
I think you may have answered this question. Jamie Crespo has a question. How long am I immune? In other words, how long does that immunity last once I get the vaccine?
We don't know.
Okay, the science is not there yet.
We're just so happy to have a vaccine, but we are building this bus as we're driving it. We have no idea. We're guessing based on other models. It might have to be a yearly booster. It might have to be every 2 years. You should expect to get a booster at some point because the way this virus works, it changes so rapidly. And the way our immune system works, it tends to forget that kind of response and need a booster after a certain period of time. Great question.
Denise?
Yes. Yeah, these are all good questions, good information for parents and families to feel more comfortable with getting the vaccine. And I think I like the fact that it's free, it's available. And if people are having challenges, I guess, getting to any sites, I'm sure that if you contact the city of Trenton, they will be able to help brainstorm with you as to how you can get transported to those sites. And I'll let Dr. Lopez kind of expand on that if any families are having challenges getting to the centers.
Absolutely. So when we do call, because we still have to do the registration, when we pull them from the state registry, we have to call and schedule them for the appointment. So 235 individuals we will be calling. And so when we do call, that is one of the questions, will you have difficulty going to the location? And that's where we will provide transportation if that is the case. So they don't have to worry about that at all. We will do that for the city.
Great.
That's great.
Yano?
I think we covered a lot of ground, and our participants are asking great questions. So, we have very experienced, panelists tonight. So what is your message that we should be repeating? I already heard one that I'll make sure I use, which is COVID-19 Know Your Status, right? Like that's sharp, that's quick, that's easy, and we're giving people, their opportunity to get to get tested, right? Every day matters, right? Attend today, achieve tomorrow. That's our internal slogan that Ms. Denise put together for attendance, right? So we have quite a few important campaigns that we're launching together. But what's your message to the rest of the community, in terms of the bigger picture, on the social emotional health side, what can we do to maintain our sanity and to be comfortable and to feel safe as we continue through this pandemic. And I'll throw that at Dr. Lopez first, and then Dr. Evans.
Yes, that's fine. So looking at it from a holistic and wellness perspective, we can't do this alone, right? There's no solo work when it comes to this. It's all about a collaborative effort. And I always say this, we are in this together, in which we are. We know COVID's going to be here for some time. I never like to put time frames on it because I know everybody wants to know. I hear them asking Dr. Evans, well, how long is the immunity? How long is this? It's all new. You will see scientists and researchers working in real time because this is something new. So they're learning as we go along. So just being able to focus on that and how can we live holistically? How can we be healthy and still move forward and have our children return back to school, right? That is truly important. And so I look at that as vaccination, again, testing, knowing your status, and we adhering to the CDC guidelines. And that's wearing a mask, that is washing your hands, watching your distance. And I will say for individuals in the city of Trenton, if you do not have mask, then also reach out to that number, 609-989-3242, press 0 for the operator, or even send an email to the COVID VAC email and let us know that you need masks, because we will also provide that as well. And that's for the children, because that is very important, because that's the only way that we're going to be able to move forward and live a holistic and a healthy lifestyle and living in the environment of COVID. I hate to say that, but this is where we are. So we have to live with COVID, and how do we do that holistically and healthy is by adhering to those measures that I just mentioned today.
And I want to add, we should add Trenton Mask Up.
Trenton Mask Up. All right.
We're on to something here. We got to do our slogan campaign, right? So Dr. Evans, just same question, like what's your message to our community, to our staff? This is being recorded. We're going to share this out on our YouTube page. So what's the message that we should be, generating and repeating for our families?
I would add exactly what we just heard Dr. Lopez say. We are all in this together. And when we really think about the health of our entire community, that's when I see people just making the choices that we need to make to keep everybody safe and healthy. Just really thinking how much we are all connected, and every choice I make affects the health of everybody around me. And we know we can do it. We have seen our numbers fall, fortunately, from the second wave over the past several weeks. And that's really because each person did one thing a little different. Each person chose to wear a mask in a setting they might not have, or put off a gathering they were maybe going to have, just made one, and it's one choice at a time that really makes that difference in terms of our numbers. And the more we think about ourselves, I'm so tired, I'm not going to wear this mask, I don't want to do this, I'm not going to get the vaccine, I'm worried about myself, that's when numbers go up higher. But when we think about everybody else, here's what I can do to protect you. I really want to learn more about the science of the vaccine, so I'm not worried about myself, and I understand how it's going to protect all of us. That's where we really see things getting better. So really thinking about the health of all of us and how can we move in that direction. And then there is just, again, reach out. There's great answers about the vaccine. There's great answers about if you need a mask, what do I do if you're feeling stuck at home in a dreadful situation? We know people are isolated with domestic violence. People are isolated with mental health challenges. Reach out. There's always someone who can help. Rental assistance, if you're worried about just paying the rent, or even just those basic things about unemployment. We're lucky that we're a relatively small community. We've got a lot of resources, and we really are all in it together. So mask up for sure, know your status, and then reach out with any question.
And what's our transmission rate right now as it stands for this week?
Ooh, great question. Micah, were you on a meeting? And remember, it's been below 1, which is great. So our cases have been dropping, our transmission rate has been below 1, and our positivity has decreased a little bit. So they're all the best indicators. I would say this is one other take-home message. Right now, we're in a race against those new variants. And by some models, we're going to see a third wave with new variants by March. But if we can vaccinate enough people and truly keep making these choices where we keep ourselves and our loved ones safe, we won't have to see that second wave. So this is kind of our chance to avoid that across our community.
One of our attendees is asking a question as we close out our broadcast. Will any of the clinics in Trenton have the vaccine?
So that is really the goal. So just a little tiny big picture view. Up until now, the state has said that health centers like Henry J. Austin, city and county municipalities, we're basically all in charge of vaccinating everybody across the state. They've now let us kind of narrow that down to just our county level if we want to. Hopefully the hospitals will be able to open up eventually to do more of that. St. Francis has been partnering with us where needed. Capital is partnering with the county to help do some of that. But in terms of truly being able to get the vaccine at a health center, it probably won't be available at private offices for some time. We at Henry J. Austin have just changed our participation in the state system because we really want to prioritize local patients and community members. So please keep an eye on our website. As soon as we get enough vaccine, we're building in a process where you can schedule with us directly instead of having to go through the state. But that just depends on how much vaccine they send us. As you know, just a little bit of feedback. Some weeks we get 900 doses, some weeks we get 200 doses, and that's been really inconsistent. We feel pretty confident that once we know we have enough vaccine to share, we'll have a process where we can say, okay, go to this place on our website and you can schedule locally directly without going through the state.
Word from Dr. Grady Griffin. Dr. Griffin. You're muted, sir.
I have definitely been upgraded to the doctor part, but I'll take it.
Oh, okay.
It's all good. I'll take it. Director Grady Griffin. It's all good. I echo the same sentiments that everybody said. Know your status, mask up. It's very important. As we're out here in the community, I work the testing sites. I work the vaccine sites. You know, we walk the beat with handing out masks. There's so many resources available to the community here in the city of Trenton to keep everybody safe. You know, and it's going to be up to each individual to say to themselves that COVID-19 is serious. As the variants start to take hold of the COVID-19 community or our communities, and it starts to force its will on us, we need to make sure that although you have been vaccinated, maybe got your first shot, maybe your second shot, not to let your guard down. You know, we know that a person still can have the COVID-19 and not necessarily show signs of it, but also spread it. You know, so it's very important that we continue to stead the course. We're early on in this situation. We're still in the process of vaccinating our communities. I know Dr. Yano, I'll call him Doctor. He doesn't like the term, or not, I won't say I like it, but the herd immunity term that I use all the time. I'm still a firm believer in that. 75 to 80% of our community, I think, needs to be vaccinated. One of the things I did speak of yesterday and the day before, we were talking about bringing our school officials on board. You know, and we're behind the curve when we talk about bringing some of the teachers and the athletic directors and some of those departments, because of the fact that we have now opened our doorway to indoor sporting events and those types of things. So we have already introduced it into our school system. We need to I think the government needs to take a conscious look at what we're doing, and then in turn start to implement some of those things. Let's boost up, let's ramp up the amount of vaccines that we receive on the state and county and local level, and let's go in and start doing the work that we need to do. So I echo all the campaigns. Let's continue to push those campaigns out, and let's try to get a hold on this before it gets a hold on us. So that's all I got to say, and thank you very much for having me.
Yeah, you're welcome. Thank you for that word. We want to thank Angela, our attendees this broadcast this afternoon. Angela, Jamie, and Lucille. Amen. Our attendees, give them a round of applause and for all their great questions and their participation on our call tonight. Of course, we want to thank our City of Trenton, our Dr. Adela Amos Lopez, Director of Health and Human Services, our brother Grady Griffin, Director of Emergency Management Services. Of course, Dr. Rachel Evans, Chief Medical Officer from Henry J. Austin Health Center. You guys are such a blessing to us in our community, such a blessing to us in our school district and our families. We want to thank you for all the time and effort that you're putting in, your research, your time and study, your care for our community, your care for our people, your love for the people. It's heartfelt, and it feels warm and fuzzy inside that you guys are really out here taking the time to have broadcasts and answer questions, going many interviews and conversations. I'm sure you're probably zoomed out by now, but you felt it not robbery to come and share with us here at Trenton Board of Ed on Trenton Talks on 1300 IM, as well as WPHY Verizon Channel 28. Of course, we want to thank Micah Freeman, our supervisor of nursing. Thank you so much, Micah, for putting this together. Of course, Denise Crease, our family liaison, parent liaison coordinator, as well as our homeless liaison coordinator. Thank you so much for all the work that you do with our parents. And our acting superintendent, Alfonso Llano. Llano, you get the last word.
So thank you for always being a wonderful group of people to talk to learn about COVID-19. From the Center of Wellness, Henry J. Austin, thank you for all your support. Dr. Evans, Dr. Lopez, Director Grady Griffin, thank you, for supporting us. We have lots of collaboration to continue on, in terms of testing and vaccines for our community and for our students and our staff. So we look forward to continued partnership. And of course, Mr. Trueheart, thank you for hosting this, Trenton Talk show and giving us a platform to spread the message of safe and love for our community and keeping each other, in the safest place possible. Micah and Denise are two of our superstars in Trenton Public Schools. The work that they do is absolutely essential to getting the message out and to keeping us safe. So thank you both and continued, good luck as we move forward and stay safe. Thank you.
All right, you've been listening to Trenton Talks on WIMG 1300 AM and WPH5 Verizon Channel 28. Stay tuned next week for another broadcast from Trenton Talks and our Trenton Board of Education team. Again, thank to all of our panelists and a special thanks to all of our attendees, our parents and our community and our students out there who are asking great questions and getting, I believe, great answers to their questions. So thank you so much and have a good night.